Tenotomy is the surgical cutting of a tendon, especially as a remedy for club foot. Tendon sheath incision, e.g., for trigger finger. The physician makes an incision in a tendon sheath to release tension in the tendon. For example, this procedure would be performed to relieve trigger finger. The physician incises the skin overlying the tendon and dissects to the tendon sheath. The sheath is incised lengthwise. The incision is sutured in layers. Tenotomy, percutaneous, single, each digit. The physician incises a tendon at the subcutaneous level. The physician incises the overlying skin. The tendon is severed through the subcutaneous tissue. The incision is sutured in layers. Report each digit separately. Tenotomy, adductor of hip, percutaneous. The physician makes a small incision approximately 0.5 inches long over the origin of the adductor muscles. Dissection is carried to the adductor tendon. The physician uses a small blade to release, free by incision, the tendon. The incision is repaired in layers with sutures and strips. A spica cast is applied for 3 to 4 weeks to keep the hip in abduction. Tenotomy, adductor of hip, open. Tenotomy, adductor, subcutaneous, open, with obturator neurectomy. The physician performs a tenotomy of the adductor of the hip. An incision is made starting at the pubis and extending approximately 5 cm along the inner thigh, in line with the V adductor longus muscle. The tendinous origins of the adductor muscles are identified and separated to allow lengthening. The adductor muscles are separated from each other and the obturator nerve is located. The anterior and posterior branches of the nerve are removed. To perform a tenotomy, the tendinous origins of the adductor muscles are divided. The physician repairs the incision in layers. A cast may be applied for 3 to 6 weeks to hold the hip in abduction. Tenotomy, hip flexor, S, open. The physician makes a 10 cm to 15 cm incision overlying the anterior iliofemoral area. The iliacus muscle and femoral nerve are identified and separated. The iliacus muscle and psoas tendon are separated. The psoas tendon is transferred superiorly and sutured to the anterior capsule of the hip joint. The iliacus muscle is also sutured to the capsule. The incision is repaired in layers. Tenotomy, abductors and/or extensor, S, of hip, open. The patient is placed in a lateral position. A transverse incision is made starting just below the anterosuperior iliac spine and extending to just above the greater trochanter. The gluteus medius and minimus are tenotomized. To perform a tenotomy, the tendinous origins of the abductor muscles are separated. The incision is repaired in layers over a suction drain.